Hi, everybody. Thanks for joining us for our session today to talk about using CII-CPAR with the MedAccess EMR. My name is Chris Diamond. I'm a MedAccess user for many years, and I've been working with the AMA for the last 3 years on the CII-CPAR project. Happy to present to you today. Joining me are a few of my colleagues. Barbara McCaffrey is working the chat today, so if you have questions, please feel free to type them in the chat and Barb will answer, or if I spot them while I'm presenting, I'll try to answer as well. We also have Sheena George and Angel Heitzman with us. Welcome, guys, and welcome everybody to the presentation. We'll get started, but before I go into the presentation, I'm actually going to exit my slideshow and take you to the ACT website. So you'll notice that Barb's posted in the chat a number of links to things on the ACT website. And I wanted to show you what they look like and how to find them, because there's a lot of really good and helpful information available. So if I go to act.albertas.org and hover over Patient's Medical Home, I can click on the CII-CPAR link. And here we have a homepage, news page. I'm going to go to the primary care tools and resources page. There's also a specialist tools and resources page and a practice facilitator page. The practice facilitator page has the same information as the primary care page. It's just organized in maybe a more useful manner for practice facilitators. So Barb's posted links to the MedAccess user guide, MedAccess mapping, and the MedAccess orientation presentation. All of the slides that you're going to see today come from the MedAccess orientation presentation, and you can find it here in the readiness tools section. It's right here. It says orientation tell us MedAccess. If you click there, it'll open up the PowerPoint with all of the slides. A little bit farther down is we have the mapping section, and there's mapping information here for each of the 5 EMRs. Here are the MedAccess information. So in the guide, I'm going to reference the guide a few times during the presentation. All of the information that you need to know to get going in the EMR is there in the CII-CPAR guide. And then here, if you or somebody you know is keen to know more about mapping, we've got all of the screenshots that I'm using in the presentation are here in a 1-page poster or a 2-page poster, and as well as a corresponding community encounter digest that goes with them. And I'm going to show you all of that in a minute. Hopefully that's helpful. I'll go back to my presentation now. Just give me one moment. So there's some work to do in the EMR with CII-CPAR before you go live, and I'll go through that. It's quite easy, and nobody has any trouble with it, but you do have to set it up correctly before you get started. First thing that you need to do is to accept the terms and conditions for TELUS EMR Mobile. Many of you are probably already using it and have already done that, but if you haven't, it's as easy as going into settings and clicking a few things. You want to configure your EMR to enable sending patient encounter information. Again, the instructions to do that are in the user guide. You want to review the EMR mapping, and we're going to do that today. So hopefully after today, you'll have a much better understanding of what's mapped and what information goes. You also want to understand how to prevent encounter data from sending. Really, that's using either recording information in the chart in fields that don't send to Netcare, or using the confidentiality functions in the EMR to stop information from flowing either at a task level or a chart level or at a visit level. There's also some things to do if you are submitting panels to the Central Patient Attachment Registry. Each participant is given a panel number, and that has to be entered into the EMR. Again, easy to do. You want to configure which panel statuses are sent, and I'll show you how to do that. And then you probably want to have a look at your panel list before you go live, just to check and make sure that all of the patients that you're expecting to be there are actually there. So I mentioned that you want to indicate which of your statuses are panel statuses for the purposes of CPAR. And there's actually a new column in the panel status management box or window to help you do that. It's circled in red here. You can see that you can now choose paneled for all of the statuses. So whichever statuses, patient statuses are ones that are appropriate for paneled patients, you can click paneled, and that tells the EMR that you want to include patients with this status in your CPAR panel. You only need to do this once. You don't have to do it for every patient or every physician. But as you set up new statuses, you'll want to indicate whether they're CPAR appropriate statuses or not. I mentioned run a panel list before your first upload. pretty easy to do either in practice management reporting or just doing an advanced search. But you just want to search by provider, make sure that every patient that you think should be there is there, that there aren't any patients that you think shouldn't be there. A couple of things you want to check for: do they have a last visit date? And do they have a demographics verified date? Those things are key. The patients won't be included in panels without them. And I'll talk more about that as we go through this later in the presentation. And also you want to check to identify the total number of patients that will upload. As when you check CII-CPAR later, you'll be given a number of patients that uploaded, and you can compare that to the number of patients that you expected to upload from your EMR. For providers who are going to submit consult reports, a number of the steps are the same. You'll want to accept the terms and conditions for TELUS EMR Mobile. You'll want to enable the EMR integration with CII. There's a setting for that, and the instructions are in the user guide. And then in each of the physicians' user accounts, if they're participating, you'll go to here to features and the outbound interface and turn that on. And it's, again, instructions are in the guide for that. You don't need to remember that when the time comes to do it. The instructions are in the guide. So those are basically things that you need to do beforehand. And now I want to spend some time looking at all of the fields that come from MedAccess and where do they go, particularly in Netcare, and what does it look like in Netcare when the information flows. So you've heard in other presentations that there are 3 types of information that get shared through CII-CPAR. There's encounter data, consult reports, and panel data, and we'll go through each of these. The one, of course, that has the most information that flows is encounter data, so we'll start with that. And as you've heard before, information flows from the EMR through the data hub into Netcare, into the Community Encounter Digest report, and also to the Healthcare Data Repository. And I think you've all seen this before, that in Netcare, there's a new entry called Community Reports. That's where the CED will reside, and that's how you can find it. And hopefully you've seen this before, but we'll just quickly go through the Community Encounter Digest again, just to look at all of the pieces of it. So there's a section for community encounters, and this is where it says, you know, where was the patient seen, who did they see, what did they say they were coming in for, and what was the actual diagnosis. There's a health concern history section, so if a new problem is entered in the profile while the patient is having that visit, it'll show up here. Possible allergies, so if a new allergy is entered during that encounter, again, it'll show up here. The system's not smart enough to know for sure if it's a confirmed or a possible allergy, so any new allergy that's entered, even if it's confirmed in the EMR, shows up in the CED as a possible allergy. Measured observation, so there's a section for a limited number of vitals, blood pressure, height, weight, and waist circumference, and that shows up here. There's a referral section. If a referral is done during the encounter, it'll show up here with information about what specialty the referral was sent to and when it was sent. And there's also a field if the referrals team at the clinic are able to enter the appointment date in the EMR later on, it'll show up in the referral occurrence date. And there's an immunization section as well. Apologies that our sample CED doesn't have the immunization section, but basically what shows up here is some basic information about immunizations, and I'll show you where that comes from. And hopefully you've all seen this as well. This slide has a list of all of the data elements that are pulled through the CII-CPAR project. And if you're interested to dig deep into this, you can find that slide in the orientation presentation on the website. So just before we dig into the actual EMR spots where information comes from, just want to talk a little bit about what has to be in place for an encounter to actually flow to Netcare, because certain criteria have to be met. So after registration and setup, when a participating provider or team member creates a new visit or also modifies a previous visit, information can flow. No information, of course, flows about things that happened before the provider was set up. The visit, of course, has to be, or the chart or the visit has to be marked, not be marked as private. Patient's name, date of birth, and PHN are recorded in demographics. The provider of the visit or the person in the primary provider field has to be a registered participant in CII-CPAR, and the visit has to be signed off. Once, if a visit's not signed off, information about it won't flow until it actually is signed off. All right, so let's have a look at the actual fields where information comes from in MedAccess, because hopefully this will help bring some things together for you as you've been learning more about CI and CPAR. So first we'll talk about demographics, and you'll notice in the top left-hand corner, there's a legend with a number of different colors. Green information goes to Netcare, CII-CPAR, and the healthcare data repository. Orange information goes to Netcare and the healthcare data repository, and yellow information goes to CII-CPAR and the healthcare data repository. I'm going to focus on those three. There's also some fields that just flow to the healthcare data repository. You'll see them as we go along, and I'll mention a couple of them, but I really want to focus today on the things that are going to show up in Netcare. So you can see in the demographic section, obvious stuff. Things that I want to point out, though, are the patient status. That there has to be a patient status for CII-CPAR, and that information is shared. Provider information comes from the provider record in the EMR, and it's basic information: first name, last name, and specialty. The name of the facility actually comes from the name of the EMR. So in the CED, where it says facility, it's actually taking this name out of the site settings in the EMR. There's a number of things to talk about here in the visit. First thing I want to talk about are a couple of fields where you can actually free text type, and that information will go to Netcare. So most fields are discrete data fields, but there are a few where users can type in information, and so it's important to know that so that you're not typing in things that would be inappropriate to see in Netcare. So for example, the first one, and maybe the most important one, is the concern field. So information in this field actually starts in the appointment. What gets typed into the reason for visit field in the appointment flows through into the visit into the concern field. It can be edited as the patient goes through the visit process at the clinic, and we know that a lot of clinics have workflows around this where they use that field for some clinic communication. And that's fine, but it's important for everybody to know, once participating in CII-CPAR, that whatever's in that field is going to go to Netcare. And we've had a few clinics already who've experienced nothing serious, but things that have gone to Netcare that didn't really need to. So a couple of things there: you can change workflows to not use that field for communication. Another possible approach would be to have somebody responsible for cleaning it up at the end of the visit, so that what's there is the appropriate information to be shared to Netcare. The other one I want to talk about is the diagnosis field. So normally, if you're doing a diagnosis, if you know the number, you'll type in the number and just hit the binoculars, and it will populate the field. Or you can search for something, and when you choose it, it populates the field. But this field as well is able to be free texted, if that's a word. So you can click in there and backspace and type in whatever you want. Less likely that something inappropriate would be typed there, I think. But again, just important to know that whatever free text you put in that field will go to Netcare. You can see some other things that come out of the visit: the date and provider. And of course, the provider has to be a registered provider. And then on the observation side, you'll notice that that's where the vitals come from: blood pressure, height, weight, waist circumference. Important to notice too what's not coming from there. No information comes from the SOAP note. No information comes from the nursing notes. No free text information is pulled from a visit at all. If a patient is diagnosed with an allergy during the visit, that information about the allergen will flow to Netcare and show in the Community Encounter Digest. The only actual information from the entry, though, is what is the allergen. Everything else flows from that is associated with that report in the CED, which is basically the date and the physician, flows from other areas of the EMR. Same with the profile. If a new diagnosis is entered in the profile, in this case, we're looking at a diagnosis of diabetes. If there's a new diabetes, that will flow to Netcare. But basically, it's just the date that it was recorded in the EMR, so not the onset date. Date was recorded in the EMR and the diagnosis. I mentioned there's a few things that flow to the healthcare data repository that don't flow to Netcare. The next couple of entries are like that. So it does record new surgical histories entered. So if there's a surgical history entry during the visit, it'll note the procedure and the procedure date and send that information to the healthcare data repository. And the same with labs. It will note if a lab rec was created, it'll note that by sending the description and the date to the healthcare data repository. But those things do not map to Netcare. And finally, also any diagnostic imaging also flows to the healthcare data repository, but not to Netcare. If there's a consult request done during the encounter, the specialty that the consult request is being done to is recorded by pulling what's in the type field, and the date is also noted in Netcare, the date that the referral happened. And then if subsequently the team enters an appointment date, if one is set with the specialist office, that will also show in the CED form. I mentioned that immunizations, I noticed that Melissa has a question. Is the reason the lab rec is sent to the repository to capture the offer for screening purposes? I think among other reasons, yes, Melissa. Really, everything that's sent to the repository is for future data analytics. So it's not necessarily for screening as far as, say, ASAP is concerned, but it is for analytics to know how many screening offers or lab rec offers are being offered in the community or in the province. And then I imagine they could probably compare that to how many are actually being filled, et cetera. I hope that helps to answer the question. Yeah, you're right, Melissa, not capturing offers is a big gap that we've been working to close for some years now. I mentioned that immunization information is pulled and sent to Netcare. Like I said, unfortunately our sample CED doesn't show it, but the information that's pulled is what was the information, or what was the immunization, excuse me, pulled from the description field, when did it happen, and what was the lot number. I see that many asks, do the immunizations appear in the immunizations tab on Netcare and in the CED? At this point, no, they just appear in the CED. They don't appear in the immunizations tab. I know that Alberta Health has asked that physicians doing immunizations to starting, I believe it's in 2021, to submit those electronically. And so those things may flow sometime in the future, but for now, immunizations captured this way just show in the CED. So that's a rundown of where the information comes from for the CED in MedAccess. And I want to just look at them all kind of together so that we can see what is flowing to where and how does it help to make up the community encounter digest. So you can see we'll start at the top and go clockwise. You can see the demographic information comes in and informs who is this information for, and helps to identify the patient in Netcare. Information from the visit populates the top section of community encounters to say what were they seen for, what did they say they were coming in for. It also populates the vitals, so height, weight, blood pressure, etc. Comes into the measured observation section. One entry from, or one field from the allergy entry populates to the allergy field. Just a couple of fields from a consult request mapped to the referral section. Immunizations go to the immunization, and health concerns go to health concerns from the profile, excuse me, go to the health concern history section. I mentioned the guide a couple of times. I just want to give it a plug again. It's really worthwhile to have a look through the MedAccess EMR guide that's available on our website. That's been put together by TELUS. It's got all the information about this mapping in it, as well as the information that we've put on the website, as well as what you need to know to set up your EMR to get going. And I just want to have mention quickly using confidentiality features in the EMR. So MedAccess allows you to make a whole chart confidential, a visit confidential, or a task confidential. And anything that's confidential in the EMR will not be sent to Netcare. There are some workflow implications for making things confidential in the EMR. It makes it a little bit more difficult for other users to access that information. So making things confidential is one way to keep information from flowing. As I mentioned before, another way is to simply chart in a different area, chart in a field that does not flow to Netcare. So that's encounter information. The rest, consult information is quite easy. As you know, it again goes from the EMR through the Data Hub to Netcare, not shared to the Healthcare Data Repository. And in terms of what to do in the EMR, it's actually quite simple. If you're set up to share consult reports, then anything done in a visit is assumed to be a consult report, will not be sent to Netcare unless you check to say that you want it to. So you can see in the image at the bottom left, if you would like to send your consult letter to Netcare, you can click the checkbox to have it sent to Netcare. You can also, if you're a specialist physician who wants all of your work to go to Netcare, you can set up your EMR initially to have everything go. We anticipate that probably not too many people will want to do that, but if that's the work that you do, then you can have it set up so that you don't need to check the checkbox every time. You can just have the information flow every single time. Consult reports go into the consultations menu in Medcare. That's already there, and that's where you can go to find them. And the last part, or the last bit of information I want to talk about are panel lists shared to the Central Patient Attachment Registry. So I mentioned earlier that the information comes from demographics, and I'm showing you that information again, but I've highlighted the fields in red that are necessary for the Central Patient Attachment Registry to recognize that a patient is on a panel. So most of them are pretty obvious: first name, last name, date of birth, gender, PHN, but some things that are really important are patient status. I mentioned at the beginning that the statuses have to be set up initially one time so that the EMR recognizes them as CIPAR statuses. The primary provider must be a registered primary provider, and the patient must also have a validated date and a last visit date. So you can see the bottom right-hand corner, the demographics validated field. You'll want that to be as up-to-date as possible because that information will show in the panel conflict report, which I'll show in a second. And the patient also has to have a last visit date. They must have had at least one visit to be considered on a panel. And the last visit date pulls from the visit list. It doesn't actually pull from demographics, of course. So when patients are sent to CIPAR, 2 reports are created, as you know. I want to talk about the panel conflict report a little bit because a lot of that information actually shows up in the panel conflict report, particularly the demographics validated information. So whatever's in the demographics validated field in the bottom right-hand corner is going to flow to the panel conflict report. And it will be seen on the panel conflict report of both at your clinic, but also at the clinic of the physician or provider with whom there is a conflict. And it's important that both you and they can see the last validation date as well as the last visit date for those patients. In a lot of cases, it'll probably make it more obvious to whom the patient should properly belong. It's important to keep those things up to date. Just a quick note about how this all works. So for MedAccess, on the 10th of the month, the EMR will automatically upload the panel to CIPAR. When when that information, goes to CIPAR, it's processed immediately against the information that's in the client registry, and demographic mismatch reports are created right away, available within a day or two. And if there are any upload errors, of course, they're available the next day. In terms of the panel conflict report, CIPAR has a blockout period from the 22nd to the end of the month, and that's where it starts comparing panels to other panels it's received and creates panel conflict reports, and those are available on the second day of the following month. A quick note about e-notifications. It's exciting that e-notifications are now available in MedAccess. And an e-notification is an electronic notification from into the EMR for any emergency department visit, hospital admission, discharge, or day surgery. They're received twice daily like labs, and they come in and are assigned to the patient's CIPAR provider. You can see here that the information is fairly basic, just patient information. Where were they seen, at what time, who was the provider, what was the reason for admission, and then if there were any other additional providers notified. If the patient has more than one primary provider indicated in CIPAR, then each of the primary providers will get the notification. And you can see that at the bottom of the notification there. One other thing to note is that the dates are not necessarily going to be the same on the task side versus the observation side. The date the encounter actually happened is in the information in the observation side of the notification. I'll give a shout out one more time to our website. Please take the time to go and visit. And I would, of course, advise you to make it a favorite because there's lots of information there. The mapping slides that I mentioned are available in the orientation presentation as well as in the standalone documents that you can print up and share. Lots of information there for you to use. And I see that Barb has posted the links again. Thank you very much, Barb. That's the end of the presentation. I'm happy to open it up for questions if you want to come off mute or use the chat. Happy to answer any questions you might have. All right, not hearing or seeing any questions. Well, thank you very much for your time today. Please don't hesitate to get in touch with us if you have questions or concerns, and have a great day.